que afecta muchas personas, que es la enfermedad de corazón. So today we're going to be talking about a condition that affects everyone, and it's about heart disease. I'm going to be sharing my screen, so just give me a couple minutes. Okay, hold on a second. Shadow, can you see my screen? Okay, perfect. So like I mentioned before, so our topic is heart disease. So hoy el tema que nosotros vamos a hablar es sobre la enfermedad cardíaca. If you could unmute yourself at this moment, I greatly appreciate. So, okay. So today we're going to learn about how to define heart disease, understand the symptoms and the course of heart disease. We're also going to recognize the warning signs of heart attack and stroke. We're also going to learn about the risk factor of heart disease and ways to reduce the risk of heart disease. So hoy en esta presentación, en este taller, vamos a hablar sobre qué es enfermedad cardíaca, vamos a hablar sobre los síntomas, la causa de la enfermedad de corazón. También vamos a hablar sobre cómo reconocer los síntomas de un ataque y un ataque cerebral. Y vamos a hablar sobre los riesgos factores que afectan a una enfermedad de corazón y cómo podemos reducir estos riesgos. So I like to start my presentation with an icebreaker. So a mí me gusta empezar con hacerle preguntas a ver qué es lo que usted sabe de la enfermedad. So the first question is all cholesterol are bad for you? So la primera pregunta es, ¿todo el colesterol es malo para usted? Usted puede contestarlo por el chat, o si no, puede abrir su micrófono y contestar la pregunta. So you could unmute yourself and answer the question. And also, if not, you could just write it in the chat. So the question is all cholesterol is bad for you?
Tony said no. And
No.
Justin said no.
No, I know.
Okay, so that's correct. So not all cholesterol are bad for you. So no todo el colesterol es malo. We have the bad cholesterol and we have the good cholesterol, and we will talk about that during our presentation. So the second question is heart disease is the #1 cause of death in women, men, or both? La enfermedad de corazón es es la causa número 1 de muerte en los hombres, mujeres o en los dos. You could write it in the chat or just respond on your... Who? What was that? I heard the answer. Did someone say both? Okay, yes. Thank you, Claudia. Both. So, es correcto. So, en los dos. So, la causa de muerte de una enfermedad cardíaca es mujer y hombre. So, basically, men and women is one of the cause of heart disease. Okay, so it's both, and we will talk about it. So now let's talk about what is heart disease. So vamos a hablar sobre qué es la enfermedad cardíaca. So heart disease is any disorder that affects the heart ability to function. So la enfermedad cardíaca es una enfermedad que afecta la habilidad de el corazón funcionar normalmente. So basically what happens, the heart is a muscle, okay? El corazón es un músculo. Y the severity and the symptoms vary from one person to the other. So, la enfermedad cardíaca los síntomas es diferente a todas las personas. So everyone is different. So you might have some symptoms and you might not have no symptoms at all. So hay personas que tienen algunos síntomas y hay otra persona que no tiene ningún síntoma. So some people have severe symptoms that could cause life-threatening and even such as heart attack and stroke. So alguna persona puede tener los síntomas muy severos que puede tener un ataque de corazón y puede darle un infarto cerebral. Okay. So according to the American Heart Association, heart disease is the #1 cause of death for men, women in the United States. And 1 American die every 38 seconds. So, como le dije anterior, la enfermedad cardíaca es el #1 causa de muerte en los hombres y en las mujeres en los Estados Unidos. Y cada 38 segundos alguien muere de un ataque de corazón o un infarto cerebral. So now we're going to talk about a disease in which is called, hold on a second, in which is called arteriosclerosis. Vamos a hablar sobre una enfermedad que afecta el corazón, que es la arteriosclerosis. Okay, so as you can see, let's look at the picture. So we have a normal artery and then we have another artery. So who could tell me the difference between those two arteries? So vamos a mirar esta foto. Usted ve una arteria normal y entonces está la otra arteria. So ¿cuál es la diferencia? Who could tell me the difference? Anyone? You could unmute yourself and say the answer. What is the difference between the normal artery and the other artery?
左边正常，
Okay, so I could let you know. So
left side.
okay, so the difference is that the one in the normal artery, you could see that doesn't have anything. And then we have another artery that has some yellow things, right? And this yellow is called plaque, okay? It's called fat and it's the bad cholesterol, okay? So en esta arteria que usted ve aquí, usted ve algo amarillo. Esto amarillo es la placa y es la grasa y el colesterol. So, and what happened is with this is that it gets narrow, okay? It gets hard and it blocks any blood flow to go into the heart. So, lo que sucede es que esta arteria, cuando está esto aquí en amarillo, hay mucho, causa que las arterias se pongan muy duras y se pongan más pequeñas, ok, porque como usted ve, el fluido de la sangre no puede entrar al corazón. Y eso se llama arteriosclerosis. So that's what's called arteriosclerosis. So now let's talk about some of the risk factors, okay, that cause heart disease. So vamos a hablar sobre los riesgos factores que causan una enfermedad cardíaca. So as you can see in the picture, like smoking, high blood pressure, high cholesterol, genetics, unhealthy diet, alcohol, heart attack, if you had a heart attack before, diabetes, obesity, sex and age, physical inactivity, and stress cause, these are risk factors that can cause a heart disease. And I'm going to talk about each individual. So, estos son los riesgos factores que causan una enfermedad cardíaca, como es fumar cigarrillo, la alta presión, el colesterol, una historia familiar genética, una dieta que no es saludable, consumo de alcohol, un ataque de corazón, diabetes, obesidad, si eres femenino, masculino y también la edad, si no estar haciendo alguna actividad física y el estrés, todo esto causa, lo pone en riesgo de tener enfermedad cardíaca y voy a hablar sobre uno de ellos individual. So let's start with smoking. So smoking. Why smoking is dangerous for our heart?
Oh, yeah.
Porque es la razón que fumando cigarrillo es peligroso para el corazón. One is that chemical found in cigarette smoke decrease the amount of oxygen found in the blood. Okay, so actualmente la química, tú sabes que el cigarrillo tiene mucha química tóxica, so cigarettes has a lot of toxic chemicals. Okay, y entonces eso es lo que causa el riesgo que el oxígeno, we need oxygen to go into our body. So, y eso causa que la química del cigarrillo causa que el oxígeno no entre suficiente a los vasos sanguíneos. Smokers are more than twice as likely to have a heart attack than non-smokers. So, personas que fuman son doble propensa de tener un ataque de corazón comparado a esa persona que no fuma. So smokers have a heart attack are more likely to die suddenly within an hour than a non-smoker. So imagínense, una persona que fuma le da un ataque de corazón rápidamente y se puede morir en entre una hora comparado a una persona que no fume. So if you smoke, there is help out there that could help you to stop smoking. So high blood pressure. So la alta presión. So high blood pressure also put you at risk. Remember that I mentioned that the heart is a muscle. So el corazón es un músculo. So high blood pressure makes the heart work harder. So if your blood pressure is high, your heart is working even harder, and it could cause for your heart to get enlarged and to weaken over time. So, si usted tiene una presión alta y no está controlada, eso causa que el corazón, que es un músculo, trabaje más y más fuerte, y esto lo que causa es que el corazón se ponga más grande y un poco más débil a largo plazo. So, high pressure increase the risk of heart attack, stroke, kidney failure, and arteriosclerosis. So, si usted tiene alta presión, esto lo pone a usted en riesgo de tener que le puede dar un ataque de corazón, un infarto cerebral, problemas en los riñones y también, como le dije anterior, de la arteriosclerosis. High blood cholesterol, so el colesterol alto. So remember that I mentioned at the beginning we have the bad and the good cholesterol. Nosotros tenemos el colesterol bueno y el colesterol malo. So what we need in our body is the good cholesterol. So lo que nosotros necesitamos en nuestro cuerpo es el colesterol bueno, no es el malo, okay? So high blood cholesterol can contribute to osteoporosis. Como te digo, si usted si tiene el colesterol muy alto, esto causa la enfermedad de osteoporosis. When I show you the picture of the artery that has the yellow plaque, that's what it's called. That's what it is. So high blood cholesterol has no symptoms, okay, and many people have it without knowing it. So hay muchas personas que tienen colesterol y el colesterol uno no tiene ningún síntoma. And the only way that you would know that you have cholesterol, if your cholesterol is high or low, is by going to get a physical done. So la única manera de uno saber si uno tiene colesterol alto es haciéndose un examen físico, porque no tiene ningún síntoma. You will not have no symptoms at all. So obesity. So vamos a hablar sobre la obesidad. So cuando una persona, obesity is when you have more fat in your body. So basically what's happening is that your heart is working much harder, okay, just to bring that oxygen and that nutrient that your body needs. So cuando uno está obeso, el cuerpo, el corazón está trabajando más fuerte para traer ese oxígeno y esos vasos sanguíneos a nuestro cuerpo. Okay, obesity also contributes to high blood pressure, diabetes, and high blood cholesterol. So if you overweight, you will have these diseases. You will have high blood pressure, you will have diabetes, you will have cholesterol. Si uno tiene sobrepeso, uno está proponiendo de tener enfermedades de diabetes, de alta presión y de colesterol. If you lose 5 to 10% of your weight, your blood pressure will go down, your diabetes will go down, and your cholesterol will go down. Si usted por menos baja de 5 al 10% de su peso, en la diabetes, el colesterol y la alta presión se le baja y se le pone uno en un nivel más controlado. Okay, physical inactivity, what does that mean? So it means that if you don't do exercise, that means that you are overweight and you're going to get this disease. So it's recommended for you to do at least 30 to 60 minutes of physical activity. We recommend like 30 minutes every single day because that helps with your heart and your lungs. So es bien importante de uno hacer, si uno no tiene no es muy activo, uno debe de hacer ejercicio por menos de 30 o 70 minutos. Nosotros recomendamos 30 minutos todos los días. The best exercise is walking. So el mejor ejercicio es caminando. Okay. So what also put you at risk if you have diabetes. So que also te pone en riesgo es la diabetes. So the reason why is that if people have diabetes, they have high blood pressure and they have high cholesterol. Okay, so and what happened is that your heart is working harder just to bring that oxygen and blood, that blood into your body. So if you're diabetic, your diabetes decrease the amount of good cholesterol in your blood. So basically, remember that we have the good and the bad cholesterol. So the diabetes affect the good cholesterol. Okay, so and that's the cholesterol that we need. So la diabetes afecta el colesterol bueno. So que lo baja el colesterol bueno. Y eso no es bueno para nosotros. Nosotros necesitamos ese colesterol bueno. Okay, it also increases the amount of fat deposit into your artery walls. So también la diabetes aumenta, okay, el depósito de grasa en las arterias. So it brings more fat into your artery and we don't need that, okay, because then that's going to cause a heart attack. Okay, remember that I mentioned gender and age. So men have a greater risk of heart attack than women, and they have a heart attack early in life. So los hombres tienen más ataque de corazón a más temprana edad, okay? Age, so like that. So the older you get, your heart gets a little bit weaker, okay, and it's working more harder, and it's causing you for you to be at risk of getting a heart attack. So, por ejemplo, si usted es una persona ya de cierta edad mayor, el corazón se pone más débil y está trabajando más fuerte y eso le puede causar un ataque de corazón. So race. So African American have more severe high blood pressure than Caucasian. So las razas afroamericanas son más altos de tener alta presión. Maybe we think it's stupid how they eat. We don't know. Okay. So quizá puede ser la manera que ellos coman. Nosotros no sabemos. También la cultura, the culture. So heart disease is also high amongst Mexican American and American Indian because of higher rate of obesity. So los mexicanos americanos y los americanos indios son altos en riesgo también por la obesidad. So, y todo va eso en la cultura, en la manera de uno comer. It's just basically how we eat it. The more healthier we eat, the more healthier our body will be. So Latin women are also high risk because they reported a higher rate of obesity and smoking. So también las mujeres latinas están en alto riesgo por la simple razón por la obesidad también y también por fumar. So ahora vamos a hablar sobre lo que es un ataque de corazón. So a heart attack basically happens from your waist up. So un ataque de corazón sucede de cintura para arriba. So remember that I mentioned that your heart is a muscle, so el corazón es un músculo. And basically la función de corazón es para traer los vasos sanguíneos y los oxígenos a nuestro cuerpo. So it's just to bring that blood and oxygen to our heart. So that's the function of the heart. So what happens, like I mentioned before, in the picture of the arteries, that when you have fatty deposit, this yellow thing here that is fat, and it's forming plaque in your heart arteries. So your arteries is the main arteries in your heart, okay? And when this happens, when there's a lot of fat or in your arteries, it blocks the oxygen, and that causes a heart attack. It blocks the blood, and it forms blood clot. Okay, se forma coágulos de sangre y eso causa un ataque de corazón. Okay. So what are the signs, the symptoms of a heart attack? Like I mentioned before, some people might have some symptoms and other people might not, okay? But this is for you to be aware if you have them. Como le dije anterior, algunas personas le dan algunos síntomas, pero hay otras personas que no. Okay, so if you have shortness of breath, corta en respiración, chest pain, dolor de pecho, if you nausea or vomiting, si está vomitando, se siente un poquito con náusea, jaw pain. So if you have pain in here in your jaw, okay, that's also some of the symptoms of a heart attack. Sweating, if you're sweating, I know the weather is hot and we are sweating, that's normal. But these are some of the symptoms. Dizziness, if you feel dizziness, this is also, okay? So si se siente con dolores aquí, si se siente con dolores en esta área de aquí, o si está sudando demasiado, o se siente un poquito mareada, estos son algunos síntomas. If you have any of these symptoms, do not wait. Call 911 or go to the emergency room. Si usted se siente con alguno de estos síntomas, no espere, vaya al 911 para que lo chequeen, okay? So now we're going to talk about, oops, did I? Hold on a second, sorry. Yeah, so now we're going to talk about the stroke. So we mentioned that a heart attack is from waist up. A stroke is a little bit different because it can affect either your left side or your right side of your body. So un ataque cerebral es diferente que un ataque de corazón, porque un ataque cerebral afecta el lado izquierdo o el lado derecho. So, y lo que sucede es interrumpe el fluido de sanguíneos en el cerebro. So basically it interrupts the flow of blood to the brain. So there are two types of stroke that can occur. So hay dos tipos de ataque cerebral que le puede afectar. So the first one is called ischemic stroke. So el primero se llama un ataque ischemia. And basically, as you can see in this picture here, right here, and it's basically, this is ischemic, is a blood clot, es un coágulo de sangre, okay, que está en la vena, is in the vein, okay, and it block it can block the blood flow. So, y entonces lo que sucede es que no deja que el fluido sanguíneo entre al cerebro. Okay, so this is the blood clot. So that's what's called ischemic stroke. So, and as you can see here, so this is a plaque. So aquí está la plaqueta, la grasa. Okay, y esto también está causando un ataque cerebral. El otro se llama hemorrhagic o un infarto de hemorragia y actualmente es cuando la vena, okay, actualmente se abre, se abre actualmente. Y esto también causa un infarto cerebral, okay, como usted ve en esta aquí, ve que la vena se abrió. Okay, it burst, it opened, and you can see the hole here, okay, and over here too, Okay, y eso causa un ataque cerebral. Okay, so there's two types. So, oops. Okay, so now we're going to talk about some of the symptoms. Vamos a hablar algunos sobre los síntomas de un ataque cerebral. It could be sudden numbness, weakness of the face, in your arm, your leg, or one side of your body. So puede, algunos de los síntomas es un poquito de debilidad en la cara, en las manos, en las piernas, o en el lado derecho o en el lado izquierdo. Sometimes people have confusion because remember, it attacks your brain, okay? So it's happening in your brain. So sometimes that's why people feel confused. They have problem talking because it had affected their speech and the way how to understand things. So a veces, I don't know if you ever if you know anyone who had a stroke before, you might see that their body is a little bit different. Their speech is a little bit different. Sometimes when they're eating, their food is coming from one side, and it's because it has affected either the left or the right side. So, a veces hay personas que cuando tiene esta situación se siente confuso, tiene problema en hablar, tiene problema en comprender las cosas. Por la simple razón es que le está afectando el cerebro. Porque un ataque cerebral le afecta el cerebro. So, a veces también tiene problemas de la vista. You have problems with your eyes. Tiene también problemas en caminar. You might have problems with walking because you have loss of balance. You might feel dizzy, se siente un poquito mareado. And you might have sudden headaches when no cause, so tiene dolor de cabeza. If you are constantly with a lot of headache, my advice is for you to go to the doctor and get yourself checked just to get an MRI, just to make sure everything is okay and nothing's happening. Okay, so si usted tiene mucho dolor de cabeza y no sabe por qué es la razón, debe de hablar con su doctor para que le haga un examen más profundo como un MRI para chequear que no vaya a haber nada peligroso. Okay, so these warning signs can last for a few minutes or an hour. So algunos de estos síntomas puede ocurrir en un minuto o puede estar en una hora. Pero como le dije anterior, a veces hay personas que no saben que lo ha tenido por varios días. Okay, sometimes there's people who have a mild, we call it a mild stroke, because they don't even know that they have it after days that it happened. So that's why sometimes when you're like, oh yeah, I have like 3 or 4 mild stroke, it's because the person had it and they don't even know that it happened. Okay, unless they go to the doctor and the doctor do further tests, and that's how they will know. So a menos si el doctor, ellos van al doctor y le hace algunos exámenes más profundos. So like I mentioned before, how can we reduce heart disease? If you smoke, stop smoking. So si usted fuma, deje de fumar. If you are obese, si tiene sobre de peso, empieza a cambiar su estilo de vida, do a lifestyle changes, eat healthy, comer saludable, porque eso ayuda para bajar de peso. When you eat healthy, you lose weight. Exercise will also help with losing weight as well. Haciendo ejercicio ayuda también para rebajar de peso. And remember, 30 minutes every single day, the best exercise is walking. Stress reduction is very, very important. ¿Cómo reducir el estrés? Okay, stress reduction, you could just manage by doing meditation, by doing exercise, by doing breathing exercise as well, by doing Tai Chi as well. Haciendo ejercicio como para reducir el estrés, meditación, el yoga, el Tai Chi, caminando, haciendo ejercicio para respirar profundo, eso ayuda bastante. So also lowering your cholesterol is very important. So the number for cholesterol has to be less than 200. Okay. So para colesterol debe de ser menos de 200. So control your blood pressure. So it's very important for you to control your blood pressure. The normal is 120/80. So la presión normal es 120/80. Pero, however, there's people who have their blood pressure a little lower than that, maybe 116/60. That could be fine for that person. So that's why it's very important for you to talk to your doctor, to speak to your doctor, and find out what is your best number. So por eso es bien importante de uno hablar o consultar con su doctor para saber cuál es el mejor, cuál es el número normal para usted para la presión. So it's very important for you to check your blood pressure regularly. So es bien importante de uno chequearse la presión. You could go to any pharmacy, they do it for free. Cualquier farmacia como la Duane Reade, Rite Aid, Walgreens, CVS. Esas son farmacias que ellos tienen máquinas que usted puede ir a chequear la presión. Those are pharmacies that you could go and you could check your blood pressure for free. Okay. Another thing is do a physical exam once a year. Hacerse un examen físico una vez al año. This is very important because that's the only way doctor will know if you have high blood pressure, if your cholesterol is high, or if you have diabetes. So la manera de, or your so like I mentioned, your cholesterol is high. So la manera que uno va a saber si usted tiene alto, el colesterol alto, diabetes o la presión alta es haciéndose un físico una vez al año. So if you haven't done your physical, make sure you go and make your physical. Okay, also keep your cholesterol under control, meaning eating healthy, okay? If you take medication to lower your cholesterol, then take it the way how your doctor says it. Okay, si está tomando un medicamento para el colesterol, tómasela como el doctor se lo ha indicado. Keep a healthy weight, mantener un peso saludable porque eso le ayuda al corazón y comer una dieta saludable, comer más vegetales, más fruta, más con granos integral. So eat more fruits, more vegetables, and whole grains. Cut down on the sodium, okay. Bajar la sal, okay, es algo bien importante. Y también evitar cosas que tienen muchas azúcares. So just avoid anything that has sugar, like cake, soda, candies. You know, once in a while it's okay, but not to eat it every single day. De vez en cuando está bien, pero no comérselo todos los días. Also limit the alcohol, okay? So drinking too much alcohol can raise your blood pressure. Men should have no more than 2 alcohol a drink, and women should not have more than 1 drink. So actualmente si va a consumir alcohol, es recomendable que los hombres tomen 2 bebidas alcohólicas y las mujeres 1, porque esto afecta la presión, ok? Haciendo ejercicio regularmente, y como yo les dije anterior, dejar de fumar, quit smoking. If you need any help to quit smoking, just call 311 and they will be able to help you with assist you with giving you any program for you to quit smoking, because if you quit smoking, that also will lower your risk of heart disease. If you are diabetes, so si tiene diabetes, eso también uno tiene que manejar la diabetes. You need to manage your diabetes if you are diabetic, meaning to take your medication, also check your glucose level as well. Make sure you take it in the morning and at nighttime. And because the reason why is that if your sugar level is high, it could damage the blood vessels. So si la azúcar está muy alta, esto también puede dañar los vasos sanguíneos y también le afecta los nervios que controla el corazón. So it can affect the nerves that controls your heart, okay, and your blood vessel. So that's why it's very important to, if you are diabetic, to take your medication, to do the glucose test in the morning and in the afternoon, just to see how well it's controlled. Manage your stress. Manejar el estrés es bien importante, como le dije anterior. And sleep. Sleep is very important. Dormir es bien importante. If you don't sleep 7 to 8 hours of sleep, you'll be very cranky. Si uno no duerme 7 o 9 horas, una persona se siente un poco ya con mal humor. So, por eso el cuerpo necesita descanso. Cuando uno descansa su cuerpo, uno está más relajada, su mente está más relajada, su cuerpo está más relajado y su presión está más controlada y la diabetes también. Y también no tiene tanta obesidad, ¿ok? So, just as a reminder, okay, hold on a second. Just as a reminder, most of the risk factor of heart disease can be controlled. So, los riesgos de corazón, de un ataque cardíaco, se puede controlar. Y la manera que se puede controlar es todo lo que yo mencioné anteriormente, como comer saludable, hacer ejercicio, dormir suficiente, tomarse su medicamento. Todo el mundo está a riesgo de una enfermedad cardíaca. So everyone is at risk of heart disease. So smoking is one of the biggest risk factors. So fumando es uno de los riesgos más altos. Also controlling your high blood pressure, your cholesterol, and your diabetes can help you keep you from being a victim of heart disease. So controlando la presión, el colesterol, la diabetes, esto te ayuda a que no sea una víctima de tener una enfermedad cardíaca. Visit your doctor is very important. Like I said, the only way you're going to know that you have cholesterol, diabetes, and high blood pressure is by doing a physical exam once a year, and that's by going visiting your doctor and getting an examination. Visitando al doctor para que se haga un examen. Okay, so before we go into the question, this is just a reminder. So antes de cogerles alguna pregunta, and I just want to let you know that if you or your family are in need of health insurance, uno puede coger su teléfono en este momento y si habla en español, if you speak Spanish, and just go to the QR code, ok, el triángulo, el cuadrado, y le puedes sacar una foto con su teléfono y esto lo va a dirigir a nuestra página. So if you take a picture of a QR code, so this square that you see here, you could go and take a picture and automatically it will take you to our webpage for you to get more information about our services, our plan that we offer. If you want to know what AMPHS is doing in the community, you could follow up in Facebook, in LinkedIn, in Twitter, and in YouTube as well. If you have any questions for me, you could reach me at my email. Si tiene alguna una pregunta sobre seguro médico o necesita seguro médico para usted y su familia, if you need health insurance for you or your family, you could contact me. That's my email or by my phone number. So now it's time for questions. So ahora en este momento hay cualquier pregunta me la puede hacer en este momento. So now it's time for questions. If you have any questions, please let me know. I'm going to stop sharing. Any questions? ¿Alguna pregunta? You could write your question in the chat, or if not, you could unmute your phone and your microphone, mute your microphone, and you could ask the questions. I don't think no one has any question for me, Estela.
Hi, I have a question.
Sure.
Just as you mentioned, you say we can walk into Rite Aid or to the pharmacy to check your blood pressure, right? So do you need make appointment or you just walk in and
No, you can walk in, like in the back of the pharmacy. There's a machine that you could just go into the machine and you could just check your blood pressure. So
And-
usually towards the back of the pharmacy.
Oh, you don't need make appointment?
No, you don't need to make an appointment.
Do you need provide your insurance?
No, you don't need to provide your insurance.
All right, thank you.
Okay. I don't know if Sherry could hear me, but I think there's a question there in which I don't understand for Chinese.
No, for this, in the comment in the chat, no, it's not a question. That was just the interpretation line.
Oh, okay. Okay,
Mhm.
so that's good to know.
Yeah. Mhm. Okay.
Any other questions? ¿Alguna pregunta que tienen?
请问如果我用那种
Right.
pharmacy 里边卖的那种电子的那个血压计，可以准确的量出那个血压吗？
Jesse, you are not in the interpretation line, but let me just get everybody together. Give me 1 minute. Now you can ask it again. Okay, Sherry.
Yeah, okay. Her
can
question
you hear
is,
me?
okay, I can hear you. Her question is like, she had a thermometer, okay, then okay, to check her high blood pressure, the blood pressure. Is that correctly? Okay, it's accurately or not accurately?
What does she have to check her blood pressure?
Okay, she has a thermometer, like, I mean, the, you know, the, how measure the blood pressure, that
The
one,
blood pressure machine.
Yeah, the machine,
Yes.
yeah, the machine.
Okay,
And that is-
actually that's good if she has that, because we recommend for people to have that if you know that your blood pressure is high. So my recommendation is for her to check her blood pressure in the morning and also in the afternoon as well. And just for her to keep a record, a journal, and write the date, the time, and the number. So when she goes to the doctor, she could take that little journal with her and let the doctor know, okay, these are on this day, this is my blood pressure has been, under control, or maybe the blood pressure has been high and the doctor needs to do some changes with medication.
OK， 他是给你建议 ，OK， 应该那个量血压的那个机器应该是没问题。可是呢，他建议你每一次量血压的时候都写下你那个血压是多少早上那个量一次，还有那个下午呢再量一次。可是你要写下那个日期，今天几号我的血压是什么？然后呢，你去看医生的时候呢。就告诉医生，我这一段时间我的血压都是这样子，然后呢，医生就会告诉你的了。可是你知道啦，我他已经刚刚说过180到那个120到上压120，下压80，那就正确的。Jasmine, I want to make sure. Jasmine?
Yes.
And then it's 120 over 80, right?
Yes, 120 over 80 is the normal. However, everybody is different. So if her blood pressure is 116 over 70 and it's constantly like that, then that's normal for her. However, if it's 130 over 80 or 130 over 85, she's in that borderline already of developing already high blood pressure. The number has changed. So that's why it's very important for her to speak to the doctor and just to make sure that the doctor could tell her, no, your number 120 over 80 is the normal, or 116 over 70 is the normal. So that's why it's very important for her to know her number. Okay?
Okay.
So, and also another thing that is very important is that the older you get, your number is going to change.
OK， 他说了，你那个血压是因人而异，如果是正常的话是120，还有下压80，这个是正确的。然后如果你那个上压是116或者是70的，也是正确的。如果你到那个130，还有那个下压是80，那你要注意一下，因为这个是很接近那个高血压了哈。然后呢，他建议你去跟医生说一下。然后呢，如果你那个血压经常改变的话，或 或高或低的话，那你要注意了，就要跟医生说一下。你要看医生的时候，要跟他提出这个问题。还有问题吗？
我还想问一下，像70岁左右应该是血压应该是多少？
哦 ，OK， 他刚刚也说了，那个血压是随着年龄那个不同的。然后说你现在是70岁对吧？I mean 你的家里人是70岁，你想问一下他的血压是怎么才正常对吧？
对。
Okay. Her question is like if age like 70, and what is the correct what is the correct pressure?
That's why it's very important for her to speak to the doctor.
Okay. 她说这是很重要的，跟她的那个家庭医生谈一下这个血压的问题。因为是不同的人是不同的，年龄随着年龄增加也是不同的，所以也是那个身体或者是比较偏向于那个重或者是瘦也是不同的，所以呢一定要跟那个医生说。
好的，明白。
Any question？ 还有什么问题吗？ I think no question.
Yeah. So Estela, I guess no one else has any questions, so I'll leave it to you. So no, si no hay ninguna otra pregunta, pues yo solo voy a dejar a Estela, ¿ok? Estela.
Ok, entonces pues gracias por la presentación, Jasmine, y gracias a Sherry, and well, thank you to both Jasmine and Sherry for being here with us tonight and for sharing this very valuable information. And also thank you to BlueCross BlueShield for sponsoring these presentations or these workshops that we have been having. Y gracias a BlueCross BlueShield por patrocinar.
OK， 那谢谢你们今天，谢谢你们时间参加我们这个讲座非常感谢。
And thank you to you all that are here in this presentation. And we will be having another presentation, which is actually our last one for now with BlueCross BlueShield. It'll be our healthy eating and nutrition workshop only in English and Spanish. We already had the Chinese one last month, and we will be uploading the workshops onto our page soon. Entonces tendremos otra
我们下一次呢是有一个讲座是那个营养讲座的，可是我们上一期已经做了中文的，下一次的那个营养讲座呢就是那个西班牙文跟那个英文了，在那个七月底。What day? Okay.
This one is
July
28th.
Yeah, July 28. 7月28号了。我们有一个那个营养讲座，也是 Jasmine 跟我们说那个做的那个讲座，可是那个是那个西班牙文跟那个英文了。中文我已经帮你们做了，我不知道你们有没有参加，在那个7月初的时候我已经做了一个。还有什么问题吗？
por conectarse aquí con nosotros. Vamos a tener el siguiente taller, el último taller que vamos a tener aquí con BlueCross BlueShield por ahora, que se enfocará en la nutrición y cómo comer saludable. Esa va a ser para el 28 de julio a las 5 de la tarde. Este taller será solamente en inglés y en español. El idioma chino estará disponible en nuestra página muy pronto. Ya pasó esa sesión el mes pasado. Y si tienen alguna pregunta adicional, no duden en comunicarse con nosotros al 212-256-9036. If you have any additional questions, don't doubt in calling us. Our number is 212-256-9036.
OK， 那如果你们没有什么问题的话呢，你们是可以打电话。如果你对我们安福星或者是有什么问题需要帮助，可以打电话那个718-256-9036。谢谢。
All right, well, have a good night. Que tengan buenas noches, and thank you so much to everybody. Gracias a todos. Hasta luego.
Thank you. Have a good evening. Bye bye.
Thank you. Thank you.
Thank you very much.
Thanks.
Of course.